Fits and seizures. So again, a lot of this comes down to what you know about your dog and what's normal for your dog. So fits and seizures can be due to epilepsy. So we get our drunk-looking dog. We have poisonings, and obviously this time of year, high temperatures and disease. Some of the key things we're looking to do is actually leave the pet alone as much as possible. Have any of you guys had a dog that's had a seizure? Yeah, a couple of people nodding. It's actually to leave the dog alone. We are a big stimulus to our dog when it's having a seizure, so it's the hardest thing in the world to stand back and kind of watch but not watch. But yeah, so we want to clear a space around the pet to prevent it injuring itself or hurting anyone else. Close the curtains and the blind. Turn off the TV, radio, tell the kids to shut up, keep everybody else out of the room. Stay calm until the seizure is over. And one of the really important things, and I kind of appreciate that it's probably not something we think about doing, is whipping our phones out and videoing what's happened. Because actually it just gives the vet a bit more of an understanding about, because I always think with these, we really struggled to explain what it looked like, because we were emotional, we were trying to work out everything that was going on, whereas actually we've all got a good mobile phone, flip it out, take a quick video, this is what the dog was doing, you know what the dog was up to beforehand, you know what you were talking, what happened, was it eating something, was it a really hot day, had anything else triggered it, but actually being able to show that is really important. And then contact the vet. Now the key with this is the minute the seizure finishes, don't feel the need to pick your dog up and chuck it in the car and drive straight down here. Because the worst thing in the world that could happen is your dog then has a second seizure while it's in the car. So use that time to ring the vet and say, this has never happened before, this is what we've been doing today, I've taken a little video, I'll watch it back to yourself, explain what you're seeing, explain what was going on, and then wait for them to tell you what they want you to do. Because it may well be that they go, yep, no, okay, it's now been 10 minutes since that last seizure, please bring the dog down, we'll see it straight away. Or it may be they say, no, I think you need to wait. Nothing bad is going to, nothing worse is going to happen, but actually let's give that dog a chance to settle down. So again, it's one of those that contacting the vet is a really good thing. I actually think if you can walk out the room or you can watch the seizure finish and go, okay, that's finished, no one's allowed in there, keep the dog calm, I'm going to go and ring the vets and say this has happened, and we'll make a plan as to what we're doing next as you go forward.
So for me, the most important thing when you tell me about the seizure is a time. How long did it last for? So as Paul mentioned, you can take a video, or literally you can start your stopwatch and start timing. Okay, and that gives you the most important information. Shorter one obviously are not as serious as longer ones. And for me, that's the most important thing. Yep, and as Paul mentioned as well, turn on the stimulus, no light, don't go and say hi dog, all this sort of thing. And just remember, your dog is no longer your dog because it is having a seizure, it's lost conscious. So they may bite, not intentionally, but they may, so protect yourself. There's no point trying to calm the dog down. Best place is just leave it over there, even better, put a blanket over, just observe from a distance, that's fine. No.
Eye emergencies. So it's grass seed time of year, there's lots and lots of the little buggers around, and a lot of that can lead to sore eyes. So eye injuries can appear insignificant but can be very serious. If you are always concerned with eyes, please take your animal to the vet for advice. They can deteriorate really quite quickly. It's a bit like ears, is the thing to think about. So the key with these is it is going to be painful. It is going to kind of cause them a bit of shock, because especially if it's disorientating what they do. So if the eye is scratched or cut, or you can see there's an obvious wound in there, potentially clean with a little bit of saline, and then just apply a cold compress over that wound, and take the pet to the vet straight away. So just very, very minor things, we would do that. More serious things, you can still something in there. Please don't try and remove the debris from the wound. It's one of those things, I think we all would look and go, oh yeah, I can probably get that, but actually if we push it down further, we've caused far more issues. These guys have all the tools and all the equipment to do it. If you've got that situation, keep the eye moist. So again, that are tea towel with a bit of cold water on it, a bit of cotton wool over the affected eye, so we're not forcing the dog to keep scratching it or trying to get at it. Hold or bandage in place. Bandages on faces and on dogs are really, really difficult. Tails and faces are really quite hard. So actually in that situation, you cuddling your dog as you drive to the vets while someone else drives to the vets, and you've got holding something over its eye, absolutely fine. But again, any serious eye injuries need to come to the vet straight away. Burns. So, sadly these are more common than we think, but the good news is it's very simple and exactly the same as what we would do for ourselves. So cool the burned area as soon as possible for at least 5 minutes. If it's a chemical burn, shower the animal thoroughly as soon as you obviously can. If it's a small burn, cover with a moist bandage and make a vet appointment. If it's a large area of burn, do the same, but bring the animal to the vets as soon as possible. So we would sort of say a small area of burn on a dog like Max would be something that's smaller than a 50p piece. That's a small burn. If it's on his face or any sort of sensitive area, doesn't matter what size the burn is, we need to bring it down straight away, because again, if it's just under the eye or on the face, they're going to keep scratching at it. Wrap the animal to retain warmth, so that's where we're thinking about shock kicking in. So like we touched on at the beginning, but obviously we don't want the animal to get super, super hot. So if it's got a big area of burn down its back, for example, we're keeping it warm, but we're not insulating it as we go forward. Okay, torn claws. I'm guessing most of you will have had a pet with a torn claw at some point. Yes. So these are really, really painful. Imagine you banged your finger and the nail is going to come off. It's that last bit before the fingernail comes off. The animal will continue bothering the area until you take it off, and it will bleed profusely when it occurs. This looks like somebody's been shot. It really does. Between this and cuts on ears, this is where the dog looks like, the whole house or the car looks like something's been shot. So the key, cover with a loose bandage over the whole foot and attend the vets that day. We want to get that off as quickly as we possibly can. Anybody think of something that's really useful in this situation? Socks. Brilliant. Old pair of socks over the foot, simple little bandage at the top to stop them flicking it off, and then bring it into there. Because if it falls off while it's in the sock, great. It will soak up some of the blood. You'll need a proper bandage put on it, and they might need some pain relief if it's been done badly enough. But yeah. Okay, stings. So again, these are really common. Not so much in cats. It says a lot about us dog owners that our dogs are not the cleverest things in the world. They feel the need to chase wasps and bees round and round the garden. So just like us, animals can be allergic to bee and wasp stings. You will usually show a sign of irritation and inflammation, and what you'll get is an area of intense inflammation with a single mark in the centre. If the sting remains in place, grab and remove the venom sac. Irritation can be reduced with ice. Great if you're in the pub, not so good if you've gone on a sort of 5-mile walk and there's no ice. Bicarbonate of soda for bee stings and vinegar for wasp stings. So the next time you get fish and chips, steal some vinegar sachets. I'm not going to advise you to carry little packets of white powder around in your first aid kits though, just in case you do get stopped. But again, really quite useful, something really simple there. Again, make an appointment with the vet. If your dog's been stung once, on its leg or on its arm or something like that, and it looks fine, just give them a call and say, look, this happened, do you think I need to come in? They'll probably say yes and come in and just be checked out. If your dog's been stung in its face or in its mouth, it does need to be seen quite quickly. So we need to get the antihistamines in there, we need to get some pain relief in there. So again, it's you guys understanding and knowing a simple wee sting on the leg, absolutely fine, we'll check it out. At some point today, my dog's been stung, it's tried to eat a wasp and it stung it 3 or 4 times in its mouth. We're on our way to the vets, this is what we're bringing in, so these guys are aware of what's coming. Snake bites. So I'm a Cornish boy, lived in Norfolk for 30 years. We get the occasional grass snakes and stuff down here, but you go up to places like Norfolk and you get a lot of adders. So if any, I did think, I wasn't quite sure. So it's something to really be aware of. So snakes will always will bite quickly when disturbed. Your dog will show, or your cat will show, immediate signs of agitation and irritation, and it will appear as 2 central fang marks rather than the one we get from our bee sting or our wasp sting. The key is to prevent the spread of venom. Keep the dog as still as possible. Sadly, this is where you will need to carry the blooming thing. Because oh God, what have we done now? Try and keep the affected area or the limb as still as possible. Go straight to the nearest vets. So if you are 25-30 miles away and this happens, don't be ringing Lennon because it's too far away. You need to go to the closest vets you can possibly go to. Coat contamination. Biggest cause of coat contamination. I actually mentioned it earlier and there's nothing in the audience.
Porn?
Nope. Children. How many of you have got kids and you've been forced to endure CBeebies and CBBC? It's amazing the stuff they tell you on there. And it's amazing how many people's kids will now stick things to the dog, paint the dog, do all the things, put glue on the dog, because that's what they see and that's what they see on the telly. So actually we used to talk about things like pollen, we used to talk about fleas, we used to talk about creosote. Actually, paint. Children's paint and glue are some of the most common things we find that our dogs have been attached to. So the kids have been doing something, the dogs come wandering through. Not all necessarily intentional. The kids have been having a great time playing and painting, and the dogs come running through the middle of it. So the key with coat contamination, don't let the animal lick or eat the substance. In the same way we talked about the burns and that sort of stuff, please don't use turpentine or paint remover your animal's skin either. So you've decided to paint the house beautifully, you've done all the skirtings, and your dog's gone running up and rubbing up against it. Don't use turpentine or paint remover. What you want to do is try and use washing up liquid. If you can, cut the fur off to prevent the substances. If you've got a little pair of clippers, little beard clippers or little clippers, great. Just shave as much of off as you can. So a very dangerous, it's not really a first aid thing. We put it in because it happens far more regularly than I think most of us would like, sadly.
Gastric torsion.
Yes, that's Scott. The proper, I wasn't even going to talk about the proper terminology. It is a often fatal condition of deep-chested dogs. Yeah, absolutely fine. It's basically an excess of gas in the stomach causes the stomach to then twist. So once you've got that twisted, it's not going to untwist itself. And so the first thing we'll see is a very, very sick dog, sadly. So a lot of the common symptoms, a bloated abdomen. Sorry, I should just go back to that. Yes, it's deep-chested, but actually it can affect any dog if they're a grazer, if they're feeding, if they're eating the wrong things. If you've got a smaller dog that loves eating dead birds or dead things like that, it does run the risk of it will actually get bloated as well. So a bloated abdomen, sometimes on one side. Abdominal discomfort, again, you'll understand what's normal for your dog. If you run your hand down your dog's belly and it suddenly reacts, and it never ever does that, you know something's up. If your dog's attempting to vomit, I always think any dog attempting to vomit, something's wrong. That's never a good thing. So again, it's on my mind straight away that why is my dog trying to vomit? Is it that it's eaten some grass and it's got it stuck, or is it actually something more serious? If it's salivating, if it's panting, and if it genuinely looks like it's in distress. The biggest thing is prevention. Most practices I talk to would say if something comes in with bloat, it normally doesn't leave. It's normally pretty fatal. So it's something to be really aware of. So avoid scavenging. I know if you've got one of the breeds like this, or my spaniel, if he finds something, he's running around with it in his mouth, he's gone. Avoid sudden changes in diet. Try and avoid exercise for an hour before and after food. And if you can, do the food and water at home. I think it's something that if you buy a breed, and there is some that are obviously more prone than others, make sure you do your research with it so you understand all the things you can possibly do to keep it as simple as possible.